Hi, it's Jane, and on today's Healthier You, I am just going to tell you about my journey with fibromyalgia. Um, Back in the 90s, probably 90, probably 1990 through 95, I was working in a hospital in Fort Worth, Texas as a nurse. Worked in a respiratory infectious disease floor. We took care of also diabetics and anyone who had strokes or, those kind of things, as well as respiratory and infectious disease. And this was at a time where there was still a lot of new drugs coming out for HIV patients, and there was still a lot of people dying from HIV, which is hard on you mentally. And I'd started having these issues where I started having a lot of pain, was extremely tired, but I was still working, often overworking. But the thing was, when I was called in for extra shifts because they needed people, um, afterwards I would feel even worse than I was normally. Now I was still functioning, like regular, but when I would get home from work, I was totally exhausted, could hardly do anything. And fortunately, my boys were at an age, I had twins, were the oldest. They were at an age where they could help me a lot with cooking dinner, preparing meals, those things for the rest of them, because I had 4 children at home, was a single parent. So they were good at helping me with that. And we had started doing things during that time where I would do freezer meals so that all we had to do was pull things out, pop them in the crock pot or, stir fry or whatever, so that they were fairly easy meals to be prepared. And I was doing a lot of that. The boys were helping me with that, and we were making do. But I talked to my doctor about those kind of things going on, and at the time, he thought it was just because I was overworked, and he told me I need to take some time off. So when I took a 2-week vacation, my 2 weeks vacation for that period of time, my boys and I went camping, and the kids, we went camping, and I slept a lot, and I felt a lot better during that time. Now, I wasn't really having a lot of issues with sleep back then, but over the years, from about 1998 on, I started having issues with sleeping, and the doctors all along the way were saying, well, the sleep is leading to the tiredness. You're hypothyroid, so that's going to make you more tired. And I would tell them, well, oftentimes I get just really cold all of a sudden for no reason. And then the next day, I'm feeling like I've been hit by a Mack truck. And they told me, oh, well, the coldness, that comes along with the hypothyroidism, a lot of pains and joints and things is your hypothyroidism. And, I just couldn't get anybody to really take me serious. But eventually I had a doctor. She was an infectious disease doctor. And we were talking about some of these things, and she had said to me, we should really run an Epstein-Barr test on you, simply because you work in infectious disease. You're around a lot of people that are come in with Epstein-Barr syndrome. So, she ran all these tests, ran all these things. She came back and she had said to me, I noticed that your white count is she said it's not extremely high, but it's at a level that we would say there's some kind of infection going on. And she said the other thing I noticed is your your blood work shows that you have a high inflammation going on. She said, so we need to look at things a little closer with blood, those kind of things. They ran tests for years off and on. They couldn't find anything.
Unknown caller.
Sorry about that, folks. About to turn the phone off. So she came to me at that point and she said, you know, I think you have what's called chronic fatigue. And, you know, there aren't really any real answers for it, but you do need to get as much sleep and rest as possible. So then they put me on something for sleep. At the time, they put me on Zoloft, which is normally used for depression, those kind of things. But it also helps regulate some things in your brain for sleep issues, those kind of things. At the time, that's what they thought. So she did that, and you know, things weren't getting any better. And as we went along, I kept feeling worse and worse body-wise. I always felt like my body had been beaten, was bruised, those kind of things. And this continued clear up until I think probably about 2005. And of course, doctors just all said it's chronic fatigue and it's all related to your thyroid and all this kind of stuff. Well, about 2005, I started having these issues where I would go into a mode of I felt like I was freezing to death. I couldn't get warm no matter what. And then the next day, I could hardly move and I really had to sleep a lot. And by this time, you know, they'd found that I had Crohn's disease and I had all kinds of other issues, gastroparesis, which they all claimed was, you know, thyroid, diabetes, that kind of thing. So I was no longer working, so I could sleep as much as I needed to. But I noticed something else at that point. I had started, occasionally, I would feel like there were shards of glass all over my body. And having a bra on was the worst thing ever because it felt like it was just pressing the glass in to my body. I still had that feeling over my entire body. As you can see, I have a lot of bruises. And they all, you know, thought that was because of the inflammation that's in my body. They also thought that my thyroid issue was causing a lot of the bruising. And that's where they thought a lot of this physical pain was coming from. And that's when I started having sleep issues. During that time also, all of a sudden, I started having heavy periods, almost to the point where at times I felt like I was hemorrhaging because I would be sitting there and I'd just feel a gush. And I knew that I had to go change everything that I was wearing because, you know, I'd bled through. And that did happen quite a bit through about 2007. 2007, I went into perimenopause. By 2009, 10, I think it was 2011 or 12. I was in menopause at that point and finally stopped having all those issues and everything else. But I still had all the pain. 2007, I had an issue where doctors thought that I had frozen shoulder, simply because I was diabetic at that point because of the gastroparesis and everything. They think. They don't know. They still don't know. But they were treating me for frozen shoulder, which sometimes is a result of diabetes. But it was so bad I had it in both shoulders. Now, previously, the year before, It wasn't really quite a year before. It was about 6 months before this had happened. I had fallen down the stairs on my rear end, halfway down 14 steps. But I had reached out to the railing to try to stop myself. Didn't realize I had injured my shoulders. But after that, I was, had a lot of pain in shoulders. I assumed it was whatever was going on with my body. And then we got to a point where there was this frozen shoulder. I couldn't move. I couldn't lift my arms up any further than this without extreme pain in my shoulders. I would have spasms when I tried to put on a coat or a jacket. And of course, they're assuming this was all from frozen shoulder. At that point, the physical therapist, because I'd been doing physical therapy for this, but doing all the exercises, and I did the exercises 3 times a day. I was only supposed to do them twice a day. I was not getting any better with the movement in my shoulders, so the physical therapist started doing passive range of motion. And what that is where you are lying on a table and they actually force your shoulder to move the way it should, with a lot of force, using their body to push your muscles up. And I would cry. I would just cry. And I would come home and I was still in so much pain. Nothing was helping. So they sent me to see a rheumatologist. This rheumatologist, listened to the doctor and the physical therapist and whatnot, and okay, fine. And so he started injecting me with cortisone into the shoulders, which really didn't help. It helped with the pain, but it didn't help with range of motion any at all. And finally, there was one point the physical therapist said, "We've done all that we can do," and I couldn't get my arms higher than this on my own. So, he said, okay, just, continue with the rheumatologist and get the shots in your shoulders and, be content with what movement you do have. And I was okay with that. I was fine with that. But I started to notice along the way, eventually it got to the point where I didn't need to go for the shots. And I'd gone in for another set of shots. And he'd asked me, do you really, and this was a new rheumatologist because the other one had retired. And he'd asked me, do you feel like you really need the shot? And I said, not really, although I still do have some pain, but it's not as bad. And he got to looking at the records that the other rheumatologist had, and he said to his assistant, "We've never done x-rays on her to see if there ever really was actually frozen shoulder, or if there's arthritis in there, what's going on. Let's go do an x-ray." So they send me off to do an x-ray, and while I'm there, they come back, they read the x-ray, and they said, "The doctor wants you to go over to the MRI department and have an MRI done on both your shoulders." And I thought, yeah, but normally that takes weeks to get in. And they said, well, they had a cancellation, so go on over, get the MRI. Went over, got the MRI. They did all this, then it's a digital where they were doing it. So they sent the results straight up to the rheumatologist. I go back up. He goes, "We're not going to do any more cortisone shots." He said to me, "You had bilateral rotator cuff. You have bilateral rotator cuff tears." And I said, "Oh boy, does that mean I'm going to have surgery?" Just like that. He said, "No, they've healed enough that there is no surgeon that will touch it. They're just going to leave it alone. So you may have to be happy with the range of motion that you have to this point, blah, 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 all this kind of stuff." He said, "However, I want to do some other things because you've mentioned the feeling of glass on your skin in the past, and I've looked at your record and everything else, and you have your SED rates are high all the time. You have inflammation, and he said, I'm just kind of curious, so I'd like to just do a physical exam. And when he did the physical exam, there are 18 points on your body that when you're touched there, you cry out or jump in pain. I did that on 15 of the spots, and all he did was 15. He said, I'm going to tell you now, if you test positive for 11, he said, and you've tested positive for 15, you have a definite diagnosis of fibromyalgia. And I said, fibromyalgia? Of course, that, there was little really talked about fibromyalgia. He said, yeah, you do not have chronic fatigue. You've had most likely fibromyalgia that over the years has gotten even worse. And I was like, okay, what does this mean? So he sent me home with some information, those kind of things. But that was my first actual real diagnosis. And since then, I have discovered a lot about fibromyalgia. And one of the big things is that with fibromyalgia, that I told you about having that cold, being so cold, and then waking up the next day feeling even worse, body in pain, hardly able to move. That is your core body temperature that has actually gone down. And that's why you can't get warm and you're so cold. And that's really when you have a real big flare-up of the fibromyalgia. So you're going to see that the next day, next couple of days, you may have more pain than normal. And that is exactly what happens. You just feel like you've been beaten and battered. It hurts to move. It hurts to do a lot of things. But the best thing you can do during that period is actually get a lot of sleep. Now, doctors have said they've done all kinds of studies. They really don't know what causes this. I have heard and I've read studies where they say it's that it is a genetic defect in the way that your nerve endings are, that they aren't in the normal places that most people's nerve endings are, that they're more active, they're more fired upon, that's why you have all the pain. I've read studies where they say it's because you don't get enough sleep, you name it. So they don't really know what causes a lot of it. But throughout the years and through going through a lot of different things, dietary, those kind of things, what I have found is that sugar is the biggest culprit for me to increase fibro flare-ups. I have less pain when I am not on a lot of sugar. So I do use sugar substitutes. I have a lot of people tell me, you shouldn't use Splenda, shouldn't use sucralose, shouldn't use this, blah, blah, blah. However, by using those, I can still get sweetness factor. I do enjoy sweet things every once in a while. So I can have that without a lot of pain in my body throughout my entire body. So that is kind of my journey with fibromyalgia, finding out that I have fibromyalgia. It's been long, and coming along all these things, everything that I'm reading, some of the past experiences that I have had, not only with the heavy periods and all this other stuff, they all go right along with fibromyalgia. So I at least got a final diagnosis. And by the way, I go full range of motion on my shoulders again. So it was never frozen shoulder. And the passive range of motion was actually actively creating smaller tears again in the rotator cuffs. So that's why I was crying throughout those sessions of the passive range of motion. And of course, physical therapists had no idea because nobody had bothered to look to see if there was something else. Yeah, they had never really done an x-ray other than the one physician who did an x-ray and showed that I have a little bit of arthritis there, which is normal for my age. Although I have a lot of arthritis in the middle of my back, which I knew I did, that stemmed from an injury that I had as a child. And, just knew that's what it was. But the SED rate for me goes right along with that. My higher white count goes right along with the fibromyalgia. So yeah, that's how I was diagnosed. Like I said, it took a long time to get a diagnosis, and everything that I've gone through and all the pain, the sometimes feeling like there's shards of glass in my skin so that clothing hurts, goes right along with fibromyalgia. So yeah, that is my journey. They still don't have a cure. They still don't have answers, but you have to find what works for you if you're having these kind of issues. And they do know that if they touch these certain areas along your body, when you react in pain, that is a positive diagnosis for fibromyalgia. And he told me, he said, if I did all 18, you would test positive for every one of them. I know that. So he said 15, we know that. If you react to 11, they consider that a positive diagnosis for fibromyalgia. Do I know what is going to happen in the future with it? No. But I do know that there are some tips and tricks that I can do. And a lot of that is basically when I am doing things around the house, at home, outside, that I need to make sure that I do it in small amounts, small bursts. In other words, I can't spend a whole day cleaning. That's most likely going to throw me into a fibro flare-up. So I have to take things a little slower, a little easier than a lot of people, and I'm okay with that. All right, that is it for today's Healthier You. I hope you understand a little bit more about some of that journey with fibromyalgia. It's there's a video out there of a woman that shows where each day it feels like there's added bruises to her body. And that's pretty accurate to the way that it feels, And there isn't anything that we can do about it other than to work on it. I have had a doctor who wanted to start me on trying to think of the name of it. Starts with an L. It is a mental health medication, and some doctors use it to prescribe for the pain, those kind of things. But you actually have to take larger and larger doses of it to maintain that pain. Creates a lot of brain fog, so you aren't really with it. And I'm not willing to do that. And I don't think it's worth the risk of taking that medication. So I deal with it the way that I can. And yes, when I am having a flare-up, I do have that brain fog where things aren't clear in my head. So, I try to do things in smaller spurts so I don't get a flare-up. But that doesn't always work. Sometimes you have a flare-up and you don't know why. So, that is it. All right, guys. Remember to be a little kinder to yourself, be kinder to one another, love one another, and I will see you again soon. Bye.